This PowerPoint has been created to introduce a new nursing protocol here at Casa Colina called volume-based feeding. During this presentation, you will learn why volume-based feeding is a helpful practice, as well as how to interpret ordered changes, set up the pump, and document volume delivered appropriately. Across healthcare settings, it is well documented that patients receive less enteral feeding than that which is ordered. This typically occurs when tube feeding is turned off for tests and procedures, therapy schedules, or even for perceived intolerance, such as high gastric residuals. For more information on this topic specifically, please refer to the NetLearning PowerPoint titled Gastric Residual Volumes. As a result of underfeeding, research has shown that patients face an increased risk of infection, prolonged ventilation, and overall increased morbidity and mortality. Initiating volume-based feeding protocols has been shown to increase the total volume delivered and thereby improve patient outcomes. Recently, nursing leadership and the clinical nutrition department have partnered in establishing a new volume-based feeding protocol for Casa Colina. This will soon be included in the enteral feeding orders within Sorian. These continuous orders focus on achieving a goal volume rather than maintaining a goal rate. The included rate is calculated on a runtime of less than 24 hours, which allows the nurse to extend run times and make up for feeding that was held for therapy or tests and procedures. Included within the orders are instructions on how and when to hold. Note it will reduce focus on gastric residuals and rely more on physical signs of intolerance. The system prompts the nurse to start tube feeding at 9 p.m. every day. Throughout the day, the nurse will be expected to run the feeding, holding and restarting as needed, until the total volume has been administered. At the end of the day, the volume goal status should be documented within the plan of care. If the goal was not met, an explanation should be provided. Here is an example of a volume-based feeding order. Administer 1,000 ml of Gevity 1.5 via G-tube daily, 50 ml per hour goal rate. As you can see, the total volume is listed first, while the goal rate of 50 ml per hour is in parentheses. It is important to understand that achieving a delivery of 1,000 ml is the primary objective. An essential component of ensuring a full volume delivery is setting up the pump properly. The video link found in the notes of this video explains how to operate the enteral feeding pump. After listening to this slide, press pause, then click the link to the pump video and return to this training once it's over. Pay close attention to the instructions on entering the total daily volume or dose limit at 3 minutes 7 seconds. This will only need to be set once unless the order changes. Continue to document volumes delivered into eyes and nose throughout the day according to policy. To ensure the pump will keep track of only the volume delivered since your last check, look at the volume delivered screen, record the amount, and reset using the instructions at 4 minutes and 5 seconds. To check the total accumulated volume, press the dose check button. At the end of the 24-hour cycle, the volumes entered into eyes and nose throughout the day should add up to this number. Just before hanging a new bag and restarting the 24-hour cycle at 9 p.m. the next night, it is essential that this accumulated volume be reset to 0. This will ensure that the pump will alarm when the full ordered volume has been reached. The instructions for this can be found at 4 minutes and 28 seconds in the video. To demonstrate how to follow a volume-based feeding order, let's walk through the care given to a sample patient. A patient is admitted with a recent stroke and severe dysphagia. They have transferred from an acute care facility, NPO, with established enteral feeding. Upon transfer to rehab, the enteral feeding order is placed for the patient. It reads, administer 1,260 ml of Isosource HN via G-tube daily and includes a 70 ml per hour goal rate. Since the patient was admitted midday and the nurse started the feeding at 1 p.m., the patient only received 560 ml of formula, by 9 p.m. This information is documented within the plan of care accordingly. To start the next 24-hour period, the nurse resets the total accumulated volume to 0, hangs a new bag, and restarts the feeding. The feeding runs continuously overnight, but ends up getting paused for therapy throughout the day, and does not get turned back on immediately after the patient returns to the room. In total, the feeding is held for 4.5 hours that day, which means the total daily volume is completely administered by 7:30 p.m. At this time, the pump alarms and the nurse turns off the feeding. In the plan of care, the nurse documents that the feeding reached the goal daily volume of 1,250 mL at 7:30. In summary, here are a few key points to remember when carrying out volume-based feeding. Most importantly, be sure to program the pump with the total daily volume or dose limit upon initial order, as this will ensure the pump turns off when the full volume has been delivered. This does not need to be reset on subsequent days unless the order changes. Remember to document volume delivered according to policy throughout the day. Each time you document intake, the volume should be cleared. This should not be confused with the total volume accumulated, which should only be reset once a day when the new 24-hour period is started. Remember to document within the plan of care each day and explain why feeding did not meet the goal volume if applicable. Some example reasons might include extended therapy sessions, delayed tests and procedures, and/or poor tolerance due to specified reasons. Note, bolus feeding orders will remain the same. For reference, here are the studies cited in the beginning of the PowerPoint. For any additional questions, please reach out to the Clinical Nutrition Department at extension 3426.